Hi, this is Jane Chung. Today I wanted to talk to you about 5 pregnancy preparations that you can do that are not related to fertility. When people start preparing for pregnancy, they do research on prenatal vitamins or even visit a fertility doctor to see if they're fertile. But there are so many more things that we can do to prepare for the journey of pregnancy and labor. And there are things that we can do before conception that increases the chances of having a healthier baby. All right, first, epigenetic factors. Epigenetics is the study of how changes in the gene expression alters the organism rather than the changes in the genetic code. So this is looking at how genes are turned on or off rather than the mutations in the DNA. Some factors that induce an epigenetic change include your age, lifestyle factors, environmental changes, and disease state. What's really exciting is that studies have looked at how epigenetic changes in the mom and the dad, even before conception, inducing an epigenetic change in the embryos. This means that your lifestyle choices, environmental factors, can have an impact on the epigenetic markers of the embryos. This can even have an impact on the health of not only embryos, but all the way to the childhood and even to adulthood. So, focus on a healthy lifestyle and in hopes of inducing a positive epigenetic change to not only your health and your body, but to your future embryos and your child. The second preparation you can do is pelvic floor training. Pelvic floor muscles are the muscles surrounding your pelvis. They support your uterus, bladder, and bowel. These muscles are super important for pregnancy and labor. During pregnancy, they support your growing baby, and during labor, they stretch and strain to help with the birthing process. Studies have looked at how training these pelvic floor muscles can prevent, minimize, or treat some complications from pregnancy. These complications include urinary incontinence, or inability to hold in the urine, vaginal tearing, and prolapses, or your shift of the organs, your internal organs. The studies have found that sometimes it does help minimize or prevent some of the risk factors of complications like urinary incontinence, and also help reduce the pain after the complications happen. However, they're not 100% guaranteed to prevent some of these complications that you experience. So, what is the purpose of doing some pelvic floor training? Well, first, it does mitigate some of the risk factors, so it's important to do them. But second, even before conception, it's important to know what your pelvic floor muscles are like. So maybe they're tight, or maybe they're loose, or they're fine. It's sort of like going to the house before you buy them and see what the foundation is like. Another reason would be to have a baseline before you get pregnant and compare it to after your delivery to see the difference and to see if you need to be concerned or not if you have some of these complications. So, go see a pelvic floor physiotherapist and learn some pelvic floor trainings or exercises that you can do to see how your pelvic floor muscles are doing and hopefully strengthen them. The third non-fertility related pregnancy preparation you can do is to focus on your core muscles. During pregnancy, around 50 to 60% of the women experience a complication called diastasis recti, and this can happen and form after the labor as well. Diastasis recti is a partial or complete separation of your abdominal muscles. Sound awful? I agree. Luckily, studies have found that doing core exercises during pregnancy can help prevent or treat diastasis recti. When you have diastasis recti after delivery, the most common way to treat and manage it is to do a core-focused regimen. So, by doing core exercises before you conceive, you can have a strong foundation going into pregnancy, and it'll be easier to maintain so that you can prevent diastasis recti. Try doing 2 to 3 core-focused exercises to prepare for your pregnancy. The fourth preparation you can do is get a blood test done. Blood tests are useful in figuring out your nutrition deficiencies and to figure out which supplements you should use. prenatal vitamins in the market a little bit tricky to figure out because there's so many different brands, and each brand has different ingredient lists, and even within the same nutrients, they vary in amount. When I did a quick search online, for the first 3 results of the prenatal vitamins, they varied in the folate amount. One had like 650 micrograms, the other had like 1,000. So you start wondering, how do I figure out which ones are the best for me? In figuring this out, the first thing to remember is that the only nutrient that you need more during pregnancy and preconception is folate. The regular range or the cutoff of folate for regular adults is in 317 nanomolars per liter, but during preconception and pregnancy years, it's all the way up to 906. So you might need to supplement a little bit with folate. But with all the other nutrients, as long as you're in the healthy range, you don't need to supplement more with it. So to really figure out which prenatal vitamins will work for you, it's important to get a blood test done before you're pregnant, before you start trying, so that you can supplement for up to around 2 to 3 months if you're deficient in anything. You might find that, maybe I need a little bit more iron, or maybe I'm not in the healthy preconception range of folate, or you might find that you're healthy in every single range and you don't need to supplement. So get a blood test done, figure out which nutrients you need more of, and find the right prenatal vitamins for you. The 5th preparation I want to share with you today is genetic testing. Genetic testing is something that both you and your partner can do. And the idea is to figure out which genes or genetic diseases and factors that you might be passing on to your children. Some tests include the carrier testing or more advanced genetic testing that look at the polygenic scores. These all look at the chances of carrying down or passing down certain genetic diseases like schizophrenia or breast cancer. The results can give you a peace of mind for carrying naturally if you have low risk of passing down any genetic diseases, or it can give you a chance to figure out whether you might want to conceive naturally or through IVF. The benefit of IVF, if you have a high chance of passing down a genetic disease, is that you can look at the embryos that you harvest and figure out the genetic profile and select the healthiest baby or the healthiest embryo to put into your uterus. Get genetic testing done and figure out which method of conception is right for you. Okay, so those are the 5 pregnancy preparations that you can do that are not related to fertility. Try researching them more and see if you can include them in your preparations for conception.